Thank you. Have you got a... Hi, everybody. Yes, so I'm Nev. I work at the AHSN network, and my role there is really about interfacing between industry and the NHS and academics and all of the support groups that are out there that are required to make innovation and great ideas that you guys have actually benefit patients and save the healthcare system some money. My mic's not on. Can you all hear me? I'm prepared to shout.
Let's just check that's not on mute. Sorry, that's on mute. Try
Okay, I'm back in the room. Back in the room. Back in the room. You'll all be pleased to know there was a life sciences moment today at government. So my brag from government tonight, everybody else has had one, is that we're going to be renamed as the Health Innovation Network. So we won't be the AHSN, which is a horrible acronym. We spent 10 years convincing everybody to use it, and now we're going to change it, but probably for the best. But, you know, as I said, the AHSN network is one of 15 networks that covers the whole of England. And we've all got nice logos and names and stuff like that. But as I said, we've been around for 10 years. Interestingly, we're funded partly by the part of government that funds health. So NHS England is a major funder for us. But actually, the part of government that funds business and economy funds us as well. So the Office of Life Sciences funds a big chunk of what we do. And that really means that we are here to do two things. We're here to improve outcomes for patients and improve efficiencies in healthcare systems, but we're also here to support industry. My metrics in my bit of the business are about investment leveraged into companies that we work with, the team work with, and the jobs that we help create. That's really, really important to us. In fact, the biggest social determinant for health globally is a job. You look around the world, if you've got a job, you're going to be healthier than people who don't. So actually, if we want to grow our economy, I know this is a bit preachy, isn't it? But if we want to grow our economy, we want really vibrant businesses, vibrant SME sector, delivering healthcare solutions that make a difference for patients, but also drive those efficiencies in the healthcare system. There's not enough money out there, but there is plenty of money. We just need to use it more, in a smart way to drive all of those meet all those challenges that we have. And the slides will be available later, I'm sure. We even use QR codes. That's our digital sort of foot forward, isn't it? And you can hear some of the work that we do with some of the innovators that we work with. In fact, Taz, who's up next. Taz, how long have we known each other? We've been working together, 10 years. So we have helped Taz on his journey, but actually Taz has done the hard work. We are an organisation that sits in between all of the different bits of the system and tries to signpost and signal you into the right. If you're an SME and you've got a product or an idea, to try and get you moved rapidly along that journey where you're into the market, you're selling to the NHS, you're benefiting patients, and you're actually making some money. That's a good thing. We want you to do that. We want your commercial strategy to work. And if you wish to do really well, and Taz keeps telling me he's going to buy an island in the Bahamas when he, exits out of the business and makes a fortune, and I keep looking forward to the invite to that party. It should be a good one. But as I said, there's 15 of us across. So if you touch us in Yorkshire and Humber, we're a conduit into the rest of the country as well. So we're looking for good products that we can grow here and we can spread out across the rest of the UK. We're also really interested in good products from all over the UK and actually internationally. And we run an accelerator program in Leeds where we hothouse UK-based companies and try and accelerate them into the market. But we also bring international companies into the market who've got good ideas, and they will help serve the needs of the system and bring jobs into the UK as well. One of the things we're really, really committed to is evaluation. And I know it's only in the bottom of this slide, but evaluating the impact of your innovation in a healthcare setting is really, really important. And that can mean different things to different people. So we're really lucky tonight. We've had a director of strategy from LTHT in the room. We've had two people on the front line, that's not too grand a way of putting it, from Calderdale in the room. And actually your business case to each of them is slightly different. And your business case to the finance director is slightly different as well. And so you need to be working really, really all the time really on your evidence base on how effective your innovation is. The best way to think about that is when you're building your product right on day one, you really need to be confident you're serving a need in the system. We still, to this day, I've been at this for a number of years, we still occasionally get innovators coming to us with fantastic solutions, but they're looking for a problem. That's a really hard sell in the NHS at any time, or to any business actually. So really that fundamental understanding of the problem you're trying to solve is so important on your journey, and checking in on that constantly. You know, once you've made your first sale, your first customer, that doesn't mean you stop collecting evidence. You need to continue, because the healthcare system is going to change, patients' needs change. James talked earlier about, you know, the growing number of patients with multiple morbidities. You know, we no longer, or we can't continue to treat patients as respiratory patients when actually they've also got diabetes and they've got probably something else wrong with mental health issues or something like that. We're moving into a world where we need to be a bit more holistic in how we deal with those patients. The virtual wards program's a really good example of that as well. So that's a fantastic piece of work. We at the AHSN played our role in that as well, in terms of, you know, I say Nicola, who's here in the room, led a piece of work 2 years ago where we won some money regionally, about £1.5 million, to try virtual wards in a sort of a research evidence generation setting to see where it worked and where it didn't work. And it was as important to understand where it didn't work as where it did work. And we spent a lot of time, a lot of effort working with lots of different suppliers and lots of different bits of the system all over Yorkshire and Humber to work out that some of these systems work really well in some settings. So particularly in care homes, for example, you can you can deal with a lot of patients with one bit of kit. That's much more difficult if you're handing out expensive pieces of kit to families who've got sick children, really sick children, terminally ill children. The business case in those two scenarios are very, very different. In the care home setting, it's very cost-driven in many respects. But actually, in that paediatric setting, it's probably not a cost-effective thing to do, but it's high value for the patients and it's high value for the staff. So actually, if you build your evidence base properly, you can move away from cost and you can talk about value in different ways. And that's really important on that evidence generation journey that you all go on as well. And as I said, we're a national network. As I said, we interact with national bodies, NHS England, but also all the trade associations that are out there. You know, BIVDA, the ABHI, the ABPI. We work with some big pharma companies as well. We've got a couple in the room tonight from AZ. I think we've got, is it Paul and Chris from AZ in the room? So don't lynch them on the way out. They are friends of the NHS. But actually, they're interested in working with SMEs as well. They want to know what's out there, what's coming, what's new, what's exciting, a bit like the rest of us as well. So it's really important that system all works and plays together. You know, there's so much opportunity in the system. There's so much often bad press about the NHS, isn't there? But actually, it's a really, really efficient system of delivering care for a population. And we have to not lose sight of that as well. We need to work with it to deliver those improvements. And so we work with our commissioners, we work with partners nationally and internationally now as well. We work really closely with our local health and care systems. And you're really lucky in Leeds because your health and care systems here is really committed to working with industry, big and small, to deliver improvements. It might not feel like that all the time. It's difficult dealing with the NHS. Data access is hard. I've got to fill in forms all the time. Everything's on paper. There's the occasional fax that arrives. You know, can be a bit stressful and a bit of a nightmare. But actually, we're pretty advanced in West Yorkshire, really across the patch. The hospitals are really committed to the digital agenda. And actually, you know, if you can get in through the right door, talk to the right people in the right way, there's a real opportunity to build your business here in the city. You know, we've got great digital infrastructure, we know that, but we've also got a very, very receptive healthcare system for what you're trying to do. It's really joined up. The council is as committed to this as the healthcare system. So, you know, we're really lucky in the patch that we're in. You know, I think James talked about the pop-up hub in the hospital. You can travel the country, you won't see too many pop-up hubs in the hospital that are basically saying, come into our hospital and work with us with your innovation. So, you know, if you want to hassle James on the way out tonight about more information about how to do that, that's what they want. They want to get stuff in there. They want to kick the tires on ideas. And if it's fail fast, that's fine. I don't know. We find we work with a lot of industry people. They'd rather have a quick no than a protracted 6 months. Maybe we'll get round to it, fill in another form. A quick no is really valuable for business, and I think, again, you will usually get that in our system. And, do we do anything that's any good? Do we make a difference? Well, there's some products here that we've driven up uptake of in the system as part of a wider team. Some of these are digital products, some of these are diagnostic products. You don't really need to know the ins and outs of them. I suppose the diagnostic test at the end, PLGF test, that's a test for preeclampsia in women who've got high blood pressure and are pregnant. And it makes a difference because without that test, if you come in and present in maternity with high blood pressure, you're almost certainly admitted. This test will say you actually don't need to be admitted because you haven't got preeclampsia, you've got high blood pressure, that we can manage that at home. But it differentiates between those two. That drives real efficiency as well as health improvements in the healthcare system. Now, that test's been around for 10 years. It's a Roche, sorry, AZ guys, it's a Roche product. It's been around but the uptake was about 30 or 40%. Now, they had a good, nice guidance. What it didn't have was a commitment from the system, NHS England, and a team of, program managers and people who want to support innovators into the system to put some resource into bringing the conversation to maternity units, doing the transformational change piece, and establishing the test as one of the things that they do all the time. And that was the role the AHSN played. Now, we couldn't have done it on our own. We worked really well with the company. We worked really well with NHS England. We worked really well with the hospitals in the system to do that. Some of that stuff was fridge magnets. Let's put some fridge magnets up to remind people to do the test. Some of it's very low. It's a complex test, but some of the transformational change piece that goes around innovation can be very, very simple and very, very effective. And we try and do a lot of that in the AHSN. We've got some great people in the organisation like Nicola and others with many, many different skills. We've got people who used to work in the army. We've got ex-car salesmen, and we've got people who've worked in the NHS. We've got all sorts of people in the AHSN. And it's a bit of a village where all the skills can come together to make a difference. These are my metrics on the left-hand side for the network. For us last year, we leveraged nearly £500 million into businesses and systems to support the delivery of healthcare in the UK. That's a number. We go and ask the companies we work with, how have we done? How much money have you raised? How successful have you been nationally? And these are the numbers that we got back. So we helped create 560 jobs. We helped leverage nearly £500 million into the company. Some of that was private investment. Some of that was grant funding. Some of that was helping them with their sales. And we will record those sales numbers as well. So it's a complex space. But when we get things right, and we don't always get them right, we try to, we don't always get them right, we can really help companies grow and succeed and become really established businesses. And when they've cracked it here in the UK, we're perfectly prepared to help you into other markets. So we help our businesses that we work with export into the US. We work with all other partners to do that. We go to Dubai and Arab Health. We support businesses out there every year. And there are some businesses that we work with, across the entire sort of, global healthcare system. So we're open for business. And I don't mind travelling either. Cheap for hire. So if you want to know more about us, just log on to the AHSN website quickly before it changes name to Health Innovation Network. Although I think we've got a few months. I think officially it'll be October. So our comms team are going bananas because everything needs to be changed over the next 3 months. But we're going to be here for at least another 5 years. We've been relicensed for another 5 years. We want to work with you. If you're an innovator, we want to support our healthcare system, do better. So just engage with us. And what I'll just finish with is, just because you engage with us and we can't find a healthcare partner for you today because their priorities are here and your offering is here, things can change very, very, very rapidly. So what they need tomorrow might be different from what they wanted today. So what I would say is engage with us and keep that engagement going. It might feel that you're not getting as much as someone else is getting, but please keep engaging, persist with us. And as I said, we're a wide network, so it might not be that there's appetite in Leeds today, but maybe in Manchester, through our contacts, we can throw you over there. And occasionally, if we have to, we'll send you down south, but only if it's a business opportunity. But please do not take your business down there. It's horrible down there. We all know that, I think, don't we? So, we're very committed to the north. And but, we want to engage. We want to have dialogue. We want to build relationships over time. As I said, Taz, 5 or 10 years. Maddie's there. We've been working with Maddie for 4 or 5 years now. And, you know, they're two really successful businesses. You should go and talk to them about how they've grown their businesses, digital businesses over the last number of years, and really, you know, made an impact, improved outcomes for patients, and made really solid businesses. So please engage with us, and we will do our best. I'm going to stop there. I think I've gone on long enough, probably, as usual. And we'll go on to our next speaker.